If I could make a difference in one person's life, I'd feel like I've accomplished something. That's why I became a physician assistant. Every time I meet a patient, I have another chance to make someone's life just a little better.
Hi, my name is Linda. I'm 49 years old. I was born and raised in the greater Newark, Delaware area. I've been here all my life. I'm a single parent. My daughter is 28 years old. She is a registered nurse at Christiana Hospital, where my open heart surgery was performed December 31st, 2012. I was diagnosed by my physician's assistant, Kyra Downing, with my myxoma, which is a rare tumor, and it was in the left upper chamber of my heart. They were able to remove my tumor because of her quick diagnosis. I'm here, I'm alive, I'm healthy, life is good, and every day is a holiday for me because if my diagnosis wasn't picked up quickly, things could have been a lot different.
Linda came into the office with her father because he was concerned she might be depressed. With further evaluation, we did determine Linda had a mild case of depression and started her on medication. A few days after starting the medication, she started to experience some side effects, mainly dizziness. When we brought her back into the office, I ran another test, an EKG, to make sure that something more serious wasn't going on. I didn't really like the results, so I decided to do an echocardiogram of the heart, which revealed a mass on the left side of Linda's heart that was affecting the blood flow. Because of the seriousness and the time-sensitive aspect of this condition, I called Linda on the phone, reviewed the results, and sent her to the emergency room. A few days later, she had open heart surgery to remove the mass. Because of the echo, we were able to prevent something more serious like a sudden heart attack from occurring and saved Linda's life.
I'm very grateful to Kyra. She gave me a second chance. Thank you, Kyra, for being an excellent PA.
Has a physician assistant changed your life? Share your story with Health Monitor.
When I come to work, I know that with each patient, I have a different painting that I'm working with. And so I know that I can look at that patient and find in them what they could hopefully work on to prevent poor heart outcomes.
She's different in that she's so thorough. She's a great listener, so knowledgeable, so compassionate. And she asks about your overall health instead of just your cardiac issues, because something else might be affecting your health.
At the end of the day, my goal is that I improve patient outcomes. So when I think back at, I have a patient who lost 2 pounds, or I have a patient who added 20 minutes of physical activity a couple days a week, that just makes me so excited because I know that they're improving their short-term and long-term heart outcomes.
Has a nurse practitioner changed your life? Share your story with Health Monitor by writing to LifeChanger at healthmonitor.com.
34 years ago, I noticed my 8-year-old son was standing at the kitchen sink drinking water continuously.
Teaching is her life. She started out as her son developed diabetes at a young age, and she went from an RN to the diabetes educator.
Explain to them that education is the treatment. It's the way that they will understand what to do. And you have to be careful because a lot of people don't understand in the beginning. You have to say, you know, show me what you do. Show me where you give your insulin so that you know they're doing it correctly.
Well, you have free to ask her anything, and she doesn't rush you. You stay there quite a long time. But you feel better when you leave her. You feel absolutely better and more secure in how you're going to deal with your diabetes.
I'm a nurse who cares about people, who care that they stay well, and try to make a difference in their lives.
Has a diabetes educator changed your life? Share your story with Health Monitor by writing to LifeChanger at healthmonitor.com.